Good morning, everyone. Today, our topic is anxiety disorder. Anxiety is nothing but a diffuse, unpleasant, vague sense of apprehension, often accompanied by autonomic symptoms. It is a normal response to a danger. Anxiety is nothing but an adaptive response and it is a life saving quality. It is an alerting signal, warns impending danger, enables person to take measures to deal with the threat. Anxiety is said to be abnormal when the severity is out of proportion to the threat of danger. What is the difference between fear and anxiety? Fear is nothing but a response to known, external, definite threat. Anxiety is nothing but a response to a threat unknown, internal, and vague, which is not precise. Basically, anxiety symptoms are due to overactivity of norepinephrine. Norepinephrine is a neurotransmitter which increases the sympathetic activities, which in turn causes a lot of autonomic hyperactivity. These are physical symptoms of anxiety disorder: sweating, chest pain, tremors, dizziness, decreased sex drive, irritability, increased muscle tone, rapid breathing, and breathlessness. Some people might also experience chest tightness, palpitations, increased blood pressure. They have gastric symptoms, nausea, diarrhea, chills, hot flashes, and weakness. And there will be also reduced sleep. Psychological arousal, fearful anticipation, irritability, sensitivity to noise, restlessness, poor concentration, worrying thoughts, and there will be decreased attention, and there are also memory changes, memory disturbances when people are highly anxious. These are physiological symptoms, autonomical arousal. Gastrointestinal symptoms such as dry mouth, difficulty swallowing, epigastric discomfort, loose motion. Respiratory symptoms, constriction in chest, difficulty in inhaling, breathlessness. Cardiovascular symptoms such as palpitations, discomfort in chest, genitourinary symptoms such as increased micturition, frequency, and urgency. Muscle tensions, tremors, headache, aching muscles. Headache is mostly frontal type or bitemporal type. Hyperventilation, dizziness, tinglings in limbs, breathlessness, and also sleep disturbance. These are the major symptoms of anxiety. Types of anxiety disorder: panic disorder, specific phobia, social phobia, obsessive compulsive disorder, post traumatic stress disorder, generalized anxiety disorder. Coming to panic disorder, it is an acute, intense attack of anxiety accompanied by feelings of impending doom. Discrete periods of intense fear vary from several attacks during one day to only a few attacks during a year. The mean age of presentation is 25 years. It can develop at any age. Certain cases are reported in children, more common in females. It is more common in people who have anxiety traits. These are biological causes. Increased sympathetic tone due to increased norepinephrine, which I have told earlier. Serotonin dysfunction. The main biological areas involved in panic disorder are brainstem, limbic system, and prefrontal cortex. Genetic factors. First degree relatives of parents have higher risk. Psychosocial factors. These are cognitive behavioral therapies. Panic circle. Initially, there is a trigger or stimulus, either internal or external, which is perceived as a threat, followed by apprehension or worry about having a panic attack or any distressing situation, which is followed by physiological symptoms, body sensations such as increased trigger, autonomic hyperactivity, followed by interpretation of sensation of as a catastrophic. Psychoanalytic factors. Unsuccessful defense against anxiety, chronic sense of feeling trapped, environmental factors, traumatic separation during childhood, stressful life events, physical and sexual abuse. Panic attacks are mostly unprovoked, situational predisposed. Panic attacks can occur in mental disorders other than panic disorders, such as specific phobia, social phobia. A discrete period of intense fear or discomfort developing abruptly and reaching peak in 10 minutes, which is accompanied by palpitations, sweating, trembling or shaking, sensation of shortness of breath, feeling of choking. Chest pain or discomfort, nausea or abdominal distress, feeling dizzy, lightheaded, derealization, depersonalization, feeling of losing control or going crazy, fear of dying, that is impending doom, paresthesias, chills or hot flushes. Recurrent unexpected panic attacks, worry about consequences of the attacks, change in behavior related to the attacks. These are diagnostic criteria for panic disorder. Anxiety between the attacks are common. Fear of having an attack can be overwhelming. Extreme fear, impending doom, lasting 20 to 30 minutes. Between attacks, anticipatory anxiety would be there. These are associated symptoms. When anxiety is prolonged, most people easily go into depressive symptoms. Other phobias are also related. Psychosocial consequences such as marital discord, work problems, financial issues, alcohol related substance abuses, fear of dying results in emergency consultations. Agoraphobia. Anxiety about being in places from which escape might be difficult. For example, being outside, being in a crowd, being on a bridge or traveling in a bus train where you're not able to escape immediately. Situations are avoided or endured with marked distress or require presence of companion. Medical causes. Cardiovascular system causes congestive heart failure, hypertension, angina. Respiratory system, COPD and asthma. CNS, transient ischemic attacks, infection and stroke. Endocrine causes, thyroid, pheochromocytoma, Addison's disease, Cushing disease. Patients with hypothyroidism, drug withdrawal, alcohol or any other sedatives. Others kind of medical causes are electrolyte disturbance, SLE, anaphylaxis and systemic infections. Treatment. Pharmacotherapy. SSRIs are the main first-class drugs for anxiety. Benzodiazepines are used for acute panic attacks. Tricyclic antidepressants. Treatment should continue for 8 to 12 months. Relapse when treatment discontinued. Benzodiazepines, clonazepam or lorazepam, are used for acute panic attacks. For long-term treatment for general anxiety disorders, sertraline, paroxetine are the main drugs which have been used. Psychotherapies. Non-pharmacological treatments are cognitive therapy, respiratory training, I've played relaxation. Thank you.